Noon.
This call is now being recorded.
Good afternoon.
Good afternoon, ma'am.
Good afternoon. Good afternoon. So after lunch, it is very difficult. Post-lunch sessions are always very difficult, but still, I will try to make it as I can say as interesting as possible. But let us try. So now we are going to take this paper on interventions in counseling. So interventions means, as all of you might be knowing about, these are the actions which we prepare to bring about a change in the behavior or in the thought process of the individual. This is the action plans which are being used in counseling. So all the four volumes, this 23 is on interventions. How to conduct, how to prepare the interventions, and there are interventions where we have to use these interventions. This is the main objective of this paper. So in the first volume, first block itself, they used there are, as you know, this psychoanalysis again. So I told you there are many repetitions in this book. Psychoanalysis is being repeated here, and psychoanalysis and psychodynamics. There is a little bit difference. Both theories and concepts are proposed by Freud only. Psychoanalysis as well as psychodynamics. So dynamics is a concept. Dynamic means it is moving. Dynamic. It is not static, it is moving, it means. So what he said is this concept means that the transformation and changes of psychic energy within the personality. There are transformations and there are changes which occurs in the psychic energy of the individual personality. As I told you, in psychoanalysis, the psychic energy is being called as libido. Libido is the term used by Freud for the energy which flows, which is not static in the personality, which flows and which transforms and which changes. So what he said is this is called as a psychodynamic theory based on this concept. That means the personality transforms and changes. The energy, psychic energy within the personality transforms and changes due to environmental conditions or due to internal things. It used to change. So that creates problems in the individual. Because of that, the individual develops so many psychological problems. So with this concept, he said, as you said, as per Freud, the present is being determined by the childhood and past relationships and past actions. He focused mostly on childhood experiences and past. So, which has an influence on the present behaviors and present problems. Then he said that his concept is that human behavior and relationships are shaped by conscious and unconscious influences. So unconscious is the term which is being given lot of importance, which is given a core component of all our problems, he said. Where in unconscious is an area where there are three things will be, what is there in our unconscious, nobody knows. Unconscious is the area where the individual himself do not know. Then what do you find in unconscious is all the painful experiences of the individual. The very painful experiences of the individual are preserved in unconscious. Preserved in unconscious. No, I will tell you a small example how this happens. So when a trial is going on in a court on a rape victim, let me say it is a rape victim. So she used to, when she is asked to narrate about the event, she used to tell for something. So that happened, he came, so all these things. After some time, she says, I don't know what happened after that. That means you have an unconscious process. If the experience is very, very, very painful, which we will, without our knowledge, we send it to unconscious. Without our knowledge, it unconsciously happens and it goes to unconscious. Once it goes to unconscious, the individual may not know what is there in his unconscious, but it has an impact on our problems, reflections, and day-to-day of life behavior. So those type of painful experiences will be there in our unconscious. The second thing is, some of the ideas we will repress, we will suppress, I can say, without repression is the word, which is the suppression without our knowledge. Why we suppress those ideas? Because the society will not accept those ideas by a civilized person. Suppose, especially the ideas related to sex. Some of the ideas the individual develops related to sex are beyond our social norms. Social norms may not accept that, but still the individual develops those ideas, but he won't express them because of those ideas, the individual himself feels, see, why I got this idea. This is a wrong idea. He himself consciously feels, but he develops that type of ideas related to sex and aggression. These things will be sent to unconscious because they are very, very painful. I don't like that, but still I am getting those ideas. Hence, these things will be will be in the unconscious. So there are three things. One thing is very painful experiences. This means what I can say, these are the anti-social ideas related to sex, and anti-social means these are against to our norms. Against to our norms. These will be suppressed in our unconscious. Whenever there is an opportunity, they used to come out of that, and they create lot of psychological problems in the individual. Hence, the individual says, I am getting lot of anxiety. I don't know why. నాకు చాలా సివియర్గా ఐఎమ్ నాట్ హ్యాపీ, ఐఎమ్ వెరీ అన్హ్యాపీ, ఐ డోంట్ నో వై. ఎవ్రీథింగ్ ఈస్ గోయింగ్ ఆన్ వెల్ యాజ్ ఫర్ యాజ్ మై కాన్షియస్ లెవెల్ ఈస్ కన్సర్న్. అన్ని బాగానే జరుగుతున్నాయి, నాకు అంతా బాగుంది, బట్ ఐఎమ్ డెవలపింగ్ లాట్ ఆఫ్ యాంగ్జైటీ. ఎందుకో నాకు తెలియదు అంటాం చూడండి, దట్ ఈస్ ద థింగ్. ఆ ఎందుకో తెలియదు అనేది, దట్ ఈస్ ద రీజన్ ఈజ్ ఇన్ అవర్ unconscious motives. That is what he said. So human behavior and the relationships are shaped by conscious and unconscious influences. Conscious influences as well as unconscious influences. Not only totally unconscious, some of the influences are conscious, but the conscious influences we can understand, but unconscious influence we cannot understand. So that's why the main idea of Freud is to bring about our unconscious so that you can diagnose the person's problem, the reasons for the problem. Diagnose చేయాలంటే unconscious లో ఏముందో తెలుసుకోవాలి. ఎలా తెలుసుకోవాలి? He has developed certain techniques like pre-association, I told you yesterday, and TAT, this is projective tests. Projective tests. All these are pre-association tests. TAT is there, Rorschach-Klingspor test, all projective tests. They tries to bring about our whatever is there in our unconscious, so that based on that, it gives a hint for our counseling. This is the reason. That's why. So that all the childhood experiences with the individual terribly afraid, he forgets. Forgets means it will be sent to unconscious. Doesn't know about that, but it has an impact on our later childhood. Some of the related, అంటే ఇప్పుడు మనం చాలా చూస్తున్నాం అది. Some of the people, they say we don't want to marry, and child abuse, childhood experiences, and some used to say they are averted towards sex at their later age, and some of the people used to say so many sexual aberrations and deviations which are being seen in the society. That what he says is, consciously they may not say this is the reason. ఎందుకో నాకు తెలియదు అంటారు. ఎందుకో నాకు తెలియదు అంటే they would have experienced without their knowledge some of the events when they are in the childhood. That may be the reason. So number of cases are also, there are cases like that, who doesn't know everything. They are very normal childhood. I have seen some of the cases for one of the psychiatrist. She's an officer and a daughter. She likes, she's very good in academics and all the things. Why I am telling is, we don't know the reason. And she says, I have seen that from my uncle psychiatrist, and this is the case observed. She said she is very good everything. She is a very good artist. She used to draw pictures, paintings very well. She is 9 year old, and she likes her mother as well as her father also. But she never allows her father and mother sit together in even in the same room. She won't allow. When if father and mother are in the same room, she used to make lot of hell in the house. She used to shout, she used to throw things, she used to agitate it. This is the reason why nobody knows. In all other things, she is very good. When she is asked to write the painting, she used to draw the figure of her mother in one room and father in other room. She doesn't like. So why this? So lot of there are also certain medicines to find the, to go back and find about the reasons of the childhood also. To some extent they will reactions like that, so that to some extent we can understand the past of the things what happened. But this is one of the things which were so unconscious plays a major role in her, in our problems. For most of the problems, we don't know the causative factor in our conscious life. Even the parents don't know, the child don't know, even the adult, we don't know why. We don't know why. So for that, this psychoanalytic methods, even though they are not accepted at present, they are being followed. The techniques are being followed. So even in the case recently, also in the Tirupati case, who has killed her daughter, teachers, and even in that case they used this reaction things. So this is the only way. There is, because there is no other way, they are going for psychoanalytic technique, even though if it is not experimentally proved. So this is about the psychodynamic theory. The psychic energy transforms and changes in the personality, which is sometimes which creates problems in the, so we have to do counseling. So this is the psychodynamic counseling. It is more focused on past experiences in the development of current problem. Past experiences in the development of current problem. So this is about psychodynamic theory. The remaining theory is only Freud's theory. So you need not understand. I told you about the all the contents of Freud psychoanalytical theory. Means you have to remember psychosexual development of the individual, id, ego, superego, defense mechanisms, and conscious and unconscious. These are the important concepts given by Freud. Wherever he says something which are related to only these four areas, basic concepts and the techniques he developed, those are also very important, like free association techniques, projective techniques, all this he developed for identifying the unconscious. So these are the very important things which you have to understand wherever the psychoanalytic theory is there. There are number of times it was repeated in those books. I think you might have seen that. Number of times those are repeated. So this is psychodynamic, the other concepts being the same. The psychodynamic theory added in the first psychoanalysis theory, this movement of the psychic energy was transformation and change of psychic energy was not introduced by Freud. In the psychodynamic theory, he introduced this about the transformation and change of psychic energy in the personality. This is the reason for getting so many problems. And all the counseling techniques are same in the psychoanalysis what we explained earlier. This is one thing which was given in the first unit. And the second thing is about insight counseling. There are number of counseling types are given. Insight, every counseling technique has a base and an assumption. That assumption you should know and you should apply. What is the assumption of this counseling technique? Insight counseling technique. Insight means within. Within. This is a counseling technique. In this type of counseling, in the insight counseling, what we do is we have to bring about self-awareness of the client. This is the major objective, is to bring about to make them to understand himself first. This is the main objective of this insight. Insight means what is there within us, within the client. So you have to make them always. Counselor works as a facilitator to bring about the changes in the counselor. He won't counsel, he won't suggest anything, he won't help, he won't solve counselor's problems, client's problems he won't solve. He acts like a facilitator and makes the client to solve his problems by himself. So in this process, in the insight learning, the technique what we use is self-awareness, is to create self-awareness through our being a facilitator. You have to bring about self-awareness in the client. Self-awareness in the client. This is one, self-knowledge. Self-knowledge and understanding of the purpose of one's motives. Purpose of one's motives. I am having a motive of making the other person to suffer. This is the motive. But this is the action I am doing. Always, what I can say, this confronting and making the other person to feel sorry, and I am behaving like that. So there is a motive behind that. This self-knowledge is to bring about the motive behind these actions. Why I am behaving like this? Whenever I am saying something and whenever I am doing something, whenever I am seeing a person, I am scolding, I am shouting. What is the motive behind that? Why I am doing that? This is self-knowledge. మనం చెప్తాం, వాళ్ళు చూడంగానే నాకు చికాకు వచ్చేస్తుందండి. ఎందుకు? వాట్ ఈస్ ద మోటివ్ బిహైండ్ దట్? ఏదో ఉంది కదా మోటివ్. And the purpose and motive behind your behavior is the insight counseling. What we do is we give the client the self-knowledge to bring about a motive and purpose. This is also one of the techniques. As a facilitator, we have to make them to bring about the motive behind your behavior. So, and the purpose of one's behavior. What is the purpose? Why? There must be, in psychology what we say, that without purpose, there is a purposivism is one of the concepts. Without purpose, nobody will do anything. ఊరికినే ఎవరు ఏం చేయరు. ఎందుకు చేరారంటే ఊరికినే చేరతారా? సైకాలజీలో చాలా మంది అంటారు ఊరికినే చేరానండి అని. వై? ఊరికినే డూయింగ్ ఆల్ ద అసైన్మెంట్స్, లిసనింగ్ ఆల్ దిస్, ఊరికినే చేస్తున్నామండి. ఊరికినే ఎవరు ఏ పని చేయరు. There is a hidden purpose. You might be having a curiosity to know, maybe having a self-interest to learn. There must be some purpose. పర్పస్ లేకుండా ఈ చాక్లెట్ తీసి పక్కన కూడా పెట్టాం, టేబుల్ మీద పెన్ను కూడా పక్కన పెట్టాం. Unless there is a purpose. There is a purpose. We don't do anything. ఏదో ఫ్యూచర్ లో పర్పస్. Yes.
Ma'am,
yes.
Are insight and introspection same, madam?
No. Introspection is the individual will do and he will introspecting himself. That is also there. But in a counseling technique, introspection the individual will do by himself. Okay. In a counseling situation, when you approach a counselor with a problem, then the counselor make you to aware regarding the purpose of your action. Purpose and motive behind your behavior. This is also, but here the counselor helps. In introspection, I do it myself. Okay.
So there is no external agency in introspection.
Yes, we will do it by ourselves.
Yeah, in insight, external agency help is there.
Help is there. The counselor will help you to aware the purpose of your actions, because he approached the, and also he also makes you in insight learning to know his ability, and he also makes the person to know his abilities and also his inappropriate behaviors.
Okay, ma'am. Thank you.
Inappropriate behavior, yes. Appropriate behaviors and irrational behaviors make you to understand. So why is this behavior appropriate? Always being moody in the class or moody in the family, is it appropriate? Always aggressive in the family, is it appropriate behavior? Inappropriate and irrational behavior. This is where there are irrationality, where the counseling is required. Because of his irrationality, he loses his peace of mind, he loses his growth, and he doesn't know that it is irrational. The problem is that where the counselor helps. He thinks that it is correct, he believes it, but there are irrational beliefs. In counseling, we will identify the irrational beliefs by the client himself and make changes. ఇది నాకు ఇర్రేషనల్ బిహేవియర్, దీని ఇది ఇర్రేషనల్ది, దే బిలీవ్ దట్ ఇట్ ఈస్ రేషనల్, కానీ ఇది ఇర్రేషనల్ బిలీఫ్ కాబట్టి ప్రాబ్లమ్స్ వస్తున్నాయి. కాబట్టి హియర్ ది కౌన్సిలర్ హెల్ప్ దెమ్ టు కమ్ అవుట్ ఆఫ్ దోస్ ఇర్రేషనల్ బిలీఫ్స్. ఒక్కసారి మన బిలీఫ్ సిస్టమే మనకి చాలా ప్రాబ్లమ్స్ క్రియేట్ చేస్తుంది. సో ఇఫ్ ద బిలీఫ్స్ ఆర్ ఇర్రేషనల్, మన హెల్త్ పోతుంది, రీజన్ ఏంటంటే దానివల్ల ఏమన్నా వస్తుందంటే లేదండి నా నమ్మకం అంటాం. నమ్మకం అంటే ఇట్ ఈస్ బియాండ్ రీజన్. నమ్మకాన్ని ఎవడు క్వశ్చన్ చేయడానికి లేదు. నోబడీ కెన్ క్వశ్చన్. బిలీఫ్ ఈస్ బియాండ్ రీజన్, అండ్ బిలీఫ్స్ మేక్స్ అవర్ బిహేవియర్, అండ్ బిలీఫ్స్ మేక్స్ అవర్ బయాలజీ ఆల్సో. యూ విల్ గెట్ లాట్ ఆఫ్ చేంజెస్ ఇన్ అవర్ బాడీ బికాస్ ఆఫ్ అవర్ బిలీఫ్ సిస్టమ్. న్యూరల్ చేంజెస్ కూడా చాలా వస్తాయండి. If the beliefs are irrational, it brings so many changes. Still so many changes. Creates even mental disorders. So, belief is our biology, beliefs are our behavior, and beliefs are, if the beliefs are irrational, which creates lot of mental disorders. So, this is mainly the cognitive therapy is to bring about changes in their irrational behavior, irrational thought process. Right. So this is about insight learning. So it also tries to bring about the inappropriate behaviors and irrational thoughts. This is about, I'm making it very short about insight learning. I think you would have 3 points are there. One is self-knowledge. Second is bringing about self-knowledge and to know the purpose of motives and purpose of their behavior. And then bringing about the inappropriate behaviors and making them to understand about his abilities also. Positive thing is about his abilities also. So in the process of irrational behaviors, he may lose the thing that he is having so many abilities. He may forget about these abilities. So this is also the role of counselor in this area, right? So I'm coming to the next aspect of that, short-term counseling. Short-term counseling. This short-term counseling means this is nothing but counseling in a short few sessions. Quick counseling is short-term counseling. Earlier, the psychoanalysis, it takes years, so many sessions to bring about this unconscious and bringing about changes in the behavior. Very, very long treatment psychoanalysis. That's why even the psychodynamic theory, they made some short therapies, short sessions. They used to have 2 sessions per a week. It goes on for years, sometimes depending upon the client. So they stopped that now at present times because of this fast and rapid society. This type of counseling will never help us. We are using the techniques, but this type of counseling, nobody will come out, nobody has time to come to that. So hence the emergence of short counseling techniques emerged. So in this, the main thing is, in all short term counselings, the main thing is that to make the cut short the counseling process. Cut short the counseling process doesn't mean the process is not cut short, the time allotment is reduced. So in the counseling, the rapport building, relationship building, there are these 5 points are always same. The first, what are the first step is developing rapport building and relationship. After that, mutual discussion, identifying the problem, and the next step is using some interventions, preparing some interventions together with the client, and the next step is following the interventions, and the next is again revising the interventions, altering the interventions if needed, and then terminating the counseling. These are the steps common. Here what we do in short is quick problem identification. Don't take long time for identifying the problem. Shoot the target at a time. So you will take less time for relationship building, and we will try to understand and make the problem identification, quick problem identification, and definiteness, finiteness in sessions. I will take 3 sessions or 4 sessions. Definitely, I will tell that. These are this. Earlier, there is no question of that. Till you recover, not that. Definite sessions I am going to take. So the sessions are finite, and then making the appropriate referrals. Suppose if I think that this is not my case, I will refer it quickly. అంతా అయిపోయిన తర్వాత చివరి స్టేజ్లో కాదు రెఫర్ చేయాల్సింది. ఇది సైకియాట్రిక్ కేసు, కౌన్సిలింగ్ కేసు కాదు అని తేల్చడానికి 4 నెలలు తీసుకోకర్లా. You have to refer it quickly. If you think it is not your case, refer it quickly to a psychiatrist or whoever is a thing. And confidentiality, just like that, confidentiality is how to maintain, and open communication. This is the one of the important thing, and follow up. Open communication is very important, but the thing is that depending upon the client, you have to choose the counseling method. Suppose if he is an adolescent boy and he is quick, he doesn't want to come to so many sessions. He's at the present days, the adolescents and the children, they are very impatient. So let them do straight forward. చెప్పేదేదో స్ట్రైట్ గా చెప్పేయి అంటారు. మనం కదా ముందు ఇంట్రడక్షన్ లో వెనక ఇంట్రడక్షన్ చేస్తే వాళ్ళకి చికాకు వస్తుంది. ఇదన్నిటికి ఒక్క సెంటెన్స్ లో చదువుతారు వాళ్ళు, ఇదా నువ్వు చెప్పేది అని. దిస్ ఇస్ ద యంగ్ జనరేషన్. సో ఫర్ దెమ్ ది షార్ట్ టర్మ్ థెరపీ ఈజ్ వెరీ మచ్ యూస్ఫుల్. ఇంత డ్రాగ్ చేద్దామా, ఒక్క మాటలో చెప్పు, ఏం చెప్పదలుచుకున్నావు నువ్వు, స్ట్రైట్ గా చెప్పు అంటారు. ఎక్స్పీరియన్సే. ఎందుకు ఊరిన ఇంట్రడక్షన్, కన్క్లూజన్, నువ్వు ఇట్లా చేస్తున్నావా అట్లా ఏం వద్దు, నువ్వేం చెప్పదలుచుకున్నావు చెప్పు నాకు. This is the trend of the present youth. So the short term counseling, you should have open communication and follow up. So these are the steps in this first 2 sessions for assessment. How do you assessment means? Through your case study, through your interview, and if needed some test. All this you have to do it in 2 sessions. You have to assess the patient, assess the client, and 3 and 4, another 2 sessions for developing insights into the client. 2 sessions is sufficient for developing insights into the insights and giving the interventions. All these 2 sessions. Okay. And last 2 sessions for termination, means follow up and termination. So totally 6 sessions. This is called as a short term therapy. So here the time and the sessions are definite. We don't go on doing counseling. అంత లోపల అయితే అయినట్టు, లేకపోతే లేదు. మన ఎగ్జామ్స్ లాగా ఆ 1 year లో పాస్ అయితే పాస్ అయినట్టు, లేకపోతే లేదు, వెళ్ళిపోండి. దిస్ ఇస్ ద షార్ట్ టర్మ్ కౌన్సిలింగ్. ఫర్ సో మెనీ problems, it is very much useful. People are going for this short term counseling. ఎన్ని సెషన్స్ రావాలండి అని అడుగుతాడు ఫస్ట్ క్లయింట్ రాగానే. అంటే హీ డజంట్ వాంట్ టు కమ్ ఫర్ మెనీ సెషన్స్. సో యూ సెట్ 4 or 6 డిపెండింగ్ అపాన్ వాడు చూడంగానే మనకు తెలుస్తుంది వాడు ఎన్ని సెషన్స్ రాగలడు. దాన్ని బేస్ చేసుకొని 4 సెషన్స్ అంటే హీ విల్ హ్యాపీలీ హీ విల్ కమ్ అండ్ హీ విల్ ఇన్వాల్వ్ అండ్ హీ విల్ ఇంటరాక్ట్. ఒక సంవత్సరం రావాల్సి వస్తుంది అన్నాం అనుకోండి, హీ స్టాప్స్ కమింగ్ టు అస్. ఓ ఇంకొక కౌన్సిలర్ దగ్గర పోదాంలే అంటారు. So even though the problem is more, you should be, the short term counselings are very, very useful at present time. So మీరు ఎవరు కౌన్సిలర్ అయినా షార్ట్ టర్మ్ కౌన్సిలర్స్ కి, బట్ యూ షుడ్ బి వెరీ అలర్ట్ అండ్ యూ షుడ్ డూ ద ఇన్ ఏ క్వాలిటీ ఆఫ్ ది షార్ట్ టర్మ్ కౌన్సిలింగ్ ఈస్ వెరీ, వెరీ ఇంపార్టెంట్. Then let us come to the another thing emerged from short term counseling is brief therapies. Still brief textbook. What is that? Question paper. What do you have? All the questions. What is that called? Question book పెట్టుకొని చదువుతున్నారు కదా పిల్లలందరూ ఇప్పుడు.
Question banks.
All in one.
Question banks.
Materials. First is textbook, then is material. Material is short term. We are coming to quick, brief therapies. Brief therapies, time becomes the explicit defining feature in the therapist contract. Time is important. మిగతా నీకు తగ్గుతుందా తగ్గలేదా, we don't bother. Time is the only criteria for the counseling. So ఇంత టైంలో నేను చేస్తాను, I will do this. Here when the time is short, the counselor should be very alert. He should not drag on. He should be able to find out with some. It doesn't need much time for an intelligent counselor. Quickly he will catch hold of the problem and he will help the client by giving the insights and whatever is needed. Okay, so these are the different types of counselings given in the first book. I made it so quickly. There are repetitions. I didn't say. I am giving only the key points. I can say that. Let us come to the second volume. This is interpersonal counseling. This is very, very important. This is also called as interpersonal therapy. Interpersonal therapy or interpersonal counseling. In the beginning, in the first class itself, I told therapy is, if the problem is severe, we use some psychological therapies. We call it as therapy, interpersonal therapy. If the problem is in mild and low level, we go for interpersonal counseling. Counseling is for mild level of problems, and this therapy is for a little bit severe problems. We use whether cognitive therapy or whatever therapy is available, behavioristic therapy, whatever the therapy, we use cognitive therapies. So in counseling itself is sufficient. Without therapy, you can also do counseling for simple problems. Here, this is an interpersonal counseling. Interpersonal counseling means basically it is related to relationships. The counseling related to relationship problems. 90% of the problems are related to relationship problems only. Maybe with the spouse, maybe with the children, maybe with the boss, maybe with the neighbors, whoever is that, with relatives, sisters and brothers, whatever is that, the relationship, colleagues, the relationship problems are more at present times. The relationship problems are very more. So what do you do? Another problem is in interpersonal relationship. The person is not able to adapt himself to the roles. Every individual is plays different roles. You have to play a role like a mother, like a daughter-in-law, like a daughter in different roles, like an employee in the office, for IGNOU like a student, Like that, you have to play different roles. Suppose if you are not able to adapt yourself to the roles, it creates problem. Role adaptation is very important. Majority of the what I can say that this couple counseling, couple problems is they are not at present times they are not able to adapt to their roles. Why? Because there is no specific roles to couples now. There is fluidity of roles is there at present society. Earlier there are specific roles. This is the role of a wife, this is the role of a husband. There are clear cut specific roles are there in the earlier times. Hence the problems are less. Now the roles mixed, the fluidity of roles. I don't know what I have to do. I don't know you. The other person doesn't know what he has to do. So why don't you? Why don't you? So because of this fluidity of roles, there is role confusion, which is creating the role problems. Role problems. So adaptation in role problems. And some of the studies is telling that in most of the diverse cases, this is the role conflicts. Role conflicts are the main reasons, especially in IT industry. The couples in the IT industry, because where the work is very tense and stressful work. Stressful work. This is one. And adaptation to the current interpersonal roles, and thing is unable to adapt to the situations which are emerging situations, situations in the office or situation in the family. People are not able to adapt themselves with the situations and current relationships. So these are all these things will be treated in interpersonal counseling. In interpersonal counseling, what do you do is we will do about the problems of all these types, role conflicts and situational. So what is the objective of that? What do you do in interpersonal counseling? Why you are not able to adapt? Means there is only one. You are lacking the interpersonal skills which are required for keeping yourself, adapt yourself to the specific roles. Interpersonal skills. What are the interpersonal skills? Can you say? Can any one of you say what are the interpersonal skills? How can you make a congenial interpersonal relationship? Through communication. Communication is the basic thing for in relationships. Not having the proper communication. Then empathy, not having empathy. So what are the other things which are needed for interpersonal relationships? Knowing about the understanding, empathetic understanding is very important. Empathetic understanding is very important. So these are the so the main objective is in interpersonal counseling we use to make the person to develop interpersonal skills. Interpersonal skills means communication mainly. Communication and empathy. If you understand the other person in his own place, then there won't be many conflicts. So these are the interpersonal skills you have to develop them. So the goal is uh, rapid symptom reduction and improving social adjustment. This is the goal. Improving social adjustment and reduce the uh, symptoms, means stressful symptoms. If you are not able to adapt, the symptom is stress. Reduce the stressful symptoms. In all interpersonal relations, the symptoms are stressful, and also uh, to develop social adjustments. To develop social adjustments. So, what are the steps in interpersonal counseling? The steps in interpersonal counseling. The counseling, you as a counselor, what you have to do? As you know, the first step is rapport building. rapport building. So the problem is in interpersonal problems, suppose when there is a couple problems, most of the time the women used to complain of pain, heart pain, back pain, indigestion, fatigue. All these complaints they used to complain. These are the symptoms of stressful symptoms. Fatigue, because fatigue is one of the major symptom of fatigue means tiredness, అలసటగా ఉండడం, నిద్ర లేచినప్పటి నుంచి అలసటగా ఉండడం. ఐఎమ్ ఫీలింగ్ వీక్, వై డోంట్ యూ టేక్ కేర్ ఆఫ్ మీ? fatigue. Then pains, chest pain and weakness, chest pain, back pain, especially back pain is a symptom of stress, and shoulder pains and neck pain is also a symptom of because here the emotions are being this what I can say that through this medulla oblongata the empathetic and the system is going on. So that's why here the neck pain and back pain mostly are due to stress majority of the times. So these are the symptoms. Hence in interpersonal relationship they used to complain of many symptoms. Even though I am having all this, nobody is taking care of me. That is creating more stress. I am having all these symptoms. The symptoms definitely the individual experiences. Because of maladjustment, the stress aroused and all these symptoms I am feeling. So if you go to a doctor, he says that nothing is there in your neck. If you say complain with a chest pain and go to a cardiologist, he says everything is normal. Then you don't believe. Chest pain వస్తోంది అంటే నువ్వు ఏం లేదంటావేంటి? I will go to another doctor. ఆయన కూడా కాదంటే ఇంకా ఈసీజీలో ఏం లేదమ్మా, ఈకోలో ఏం లేదు, ఎక్కడ ఏం లేదు, why you are complaining? Then no, Guntur is not sufficient, I will go to Hyderabad. So if he is a clever doctor, then he will give some big complex and say, yes, మర్చిపోకుండా వేసుకొని రెస్ట్ తీసుకోమా తగ్గిపోతుంది అంటాడు. Oh yes, he said something is there for me, so I believe in him. So this is more psychological. Hence in counseling what you have to do is, this is very difficult even to the doctor to find out whether it is a somatoform disorder or real physical illness. Very, very difficult even for the doctor. Somatoform disorder is the somatoform. Body ki symptomatic ante. There is body system is okay, but we are getting symptomatic problems. So hence in this what you have to do is, after developing rapport, we have to rule out the physical illness. ఇలాంటి సిమ్టమ్స్ చెప్పారనుకోండి, డాక్టర్ ఏం లేదన్నాడమ్మా, బట్ స్టిల్ ఐఎమ్ గెటింగ్ గ్యాస్, ఐఎమ్ నాట్ ఏబుల్ టు డైజెస్ట్ ద థింగ్స్, ఏం తిన్నా అరగటం లేదు, ఇలా ఆల్ దీస్ ఆర్ ది సిమ్టమ్స్ ఆఫ్ స్ట్రెస్ సిమ్టమ్స్. ఐఎమ్ ఫీలింగ్ స్ట్రెస్ నువ్వు ఎందుకు ఫీల్ అవుతున్నావు అని ఎవరు చెప్పలేదు. నాట్ ఏబుల్ టు అడాప్ట్ మై సెల్ఫ్, దట్ ఈస్ ద వ్యాలిడ్ రీజన్. బికాస్ ఐఎమ్ నాట్ ఏబుల్ టు అడాప్ట్, ఐఎమ్ ఫీలింగ్ స్ట్రెస్ఫుల్. ఎందుకు అనేది క్వశ్చన్ కాదండి. కొంతమంది అడాప్ట్ అవ్వగలరు, కొంతమంది అడాప్ట్ కాలేరు. యూ హ్యావ్ టు అండర్స్టాండ్ దట్. ఇది తప్పు, లెస్, లో కానే కాదు. అడాప్టేషన్ లెవెల్స్, దేర్ ఆర్ ఇండివిజువల్ డిఫరెన్సెస్ ఇన్ అడాప్టేషన్ లెవెల్స్, ఇండివిజువల్ డిఫరెన్స్ అండ్ ఇన్ సిచ్యువేషనల్ అడాప్టేషన్ ఆల్సో. కొన్ని సిచ్యువేషన్స్ లో కొందరు అడాప్ట్ అవుతారు, కొన్ని సిచ్యువేషన్స్ లో కొందరు అడాప్ట్ అవుతారు, నాట్ ఆల్. సో యూ హ్యావ్ టు రెస్పెక్ట్ ద క్లయింట్. ఇది కూడా అడాప్ట్ అవ్వలేవా అని అనడానికి వీల్లేదు. యూ హ్యావ్ టు రెస్పెక్ట్ ద క్లయింట్. రూల్ అవుట్ ద ఫిజికల్ ఇల్నెస్ అంటే ఒకసారి డాక్టర్ దగ్గరికి పంపించి ఇవి ఏమన్నా కంప్లైంట్ చెప్తే ఏం లేవు అని తెలిసాలి ముందు. అండ్ దెన్ డిటర్మిన్ ద ప్రెసెన్స్ ఆఫ్ ఎనీ సైకియాట్రిక్ డయాగ్నోసిస్. ఇది కాకుండా సమ్ టైమ్స్ సైకియాట్రిక్ డయాగ్నోసిస్ లైక్ ఏదైనా బయోలాజికల్ గా, సైకియాట్రిక్ డయాగ్నోసిస్ లో కూడా కొంతమందికి బికాస్ ఆఫ్ న్యూ బయోలాజికల్ ఫ్యాక్టర్స్ దే మే డెవలప్ దీస్ సిమ్టమ్స్. ఎక్సెసివ్ ఎండోక్రైనల్ సెక్రేషన్స్ కావచ్చు, యాంగర్ ఎక్కువ ఉండొచ్చు, వైలెన్స్ ఎక్కువ ఉండొచ్చు, ఇలాంటివి ఎక్సెసివ్ గ్లాండ్యులర్ సెక్రేషన్స్ వల్ల కూడా రావచ్చు. సో ఇట్ ఈస్ బిహేవియరల్ ప్రాబ్లం అని అనడానికి వీల్లేదు. not able to adapt అనడానికి వీల్లేదు. There are psychiatric problem behind that. So we have to rule out this too. కాబట్టి ఇంటర్పర్సనల్ ప్రాబ్లం అనంగానే మనం కౌన్సిలింగ్ ఒకటే ఇది కూడా చేత కాదా అని డోంట్ అండర్మైన్ దెమ్, నెవర్ అండర్మైన్ దెమ్. దిస్ ఇస్ వీ హ్యావ్ టు రెస్పెక్ట్ ద పీపుల్. Don't never undermine the person who is suffering with whatever level, whatever stress conditions, whatever non-adaptability they are having. Look them empathetically and find out the reason and try to help them by giving the proper counseling. So these are two things. One is rule out the physical illnesses and find out whether there are any psychiatric diagnosis, because in interpersonal relations they exhibit all these physical symptoms. And next, explore the current interpersonal and social situations. Then explore about the current interpersonal relations and social situations, what the individual is experiencing. All this takes time because I am explaining. You can do it quickly. While doing it won't take this much time. Then explore the current interpersonal and social situation. Now we are able to find out the present problem here. And here in all interpersonal relationships, what the counselor is, counselor has to identify the stressors. Stressors means the events or the people or the situations which are creating stress. ఏంటి స్ట్రెస్ క్రియేట్ చేస్తున్నాయి నీకు? ఈ గురు సిలబస్సా లేకపోతే సమ్ అదర్ థింగ్? వాట్ ఈస్ క్రియేటింగ్ స్ట్రెస్ ఇన్ యూ? యూ హ్యావ్ టు ఫైట్. దిస్ సిలబస్ ఈస్ కాల్డ్ as stressors. Okay, so you have to find out the stressors. Stressors means unless you have to always try to find out the stressors. The person may not be knowing the stressors. So identify the patient's current stressors. Then make the client to deal with the stressors. To deal with the stressors more positively. ఆ స్ట్రెస్సార్స్ తో డీల్ చేయడం, అడాప్ట్ చేయడం. స్ట్రెస్సార్స్ ఉన్నప్పుడు మోస్ట్ ఆఫ్ ది టైమ్ యూ విల్ గివ్ రిలాక్సేషన్ థెరపీస్. ఆల్ దిస్, ఇఫ్ యు ఆర్ రిలాక్స్డ్ and if you use other adaptive measures, then you can come out of that. And then sometimes you have to give homework assignment and termination. This is about interpersonal counseling. So this is interpersonal counseling is very important because most of the clients come with interpersonal problems. Then what are the skills required for IPT counselor? కౌన్సిలర్కి ఏం స్కిల్స్ ఉండాలి? దిస్ interpersonal therapy counselor should have communication skills. Means he should be able to speak with the client empathetically, and also he should be able to understand the client's words, hidden meaning of the client's words, positive also clearly. వాళ్ళు ఏం చెప్తున్నారో అర్థం కావాలి, నువ్వేం చెప్తున్నావో కూడా కరెక్ట్గా చెప్పాలి. There are two things. You should be able to understand the client's words in a proper way. And if there are any hidden hints, that also you have to understand. Similarly, you have to know how to communicate with these are the communication skills of the IPT counselor. Then you should have assertiveness skills. Assertive means you should be able, whatever you want to say, you should be able to say to the client in a positive way, proper way. In a proper way, assertive way. Assertive means without hurting the client. You can explain whatever the feeling is. I will tell you very simply. You should be able to say no in an assertive way. Assertive ga no anedi without hurting others, you should be able to say. How can you say no? In a socially acceptable way. Similarly, The counselor has to tell the negative things in an assertive way, means in a without hurting the client. He should be able to tell in a positive way regarding this. Uh, these are the skills required, and the conflict resolution skills the counselor should have. Most of the interpersonal conflicts, so he should be able to resolve the conflicts, and he should be able to manage anger management. Anger management. He himself should have anger management. Sometimes the relationship in this during the counseling sessions also, he should be able to manage his anger, and he should be able to manage the emotions of the client also. Able to manage the emotions of the client also. These are the skills required. These are the, of course, in all the counseling, these are the skills required. Extra things required is assertiveness and anger management, because in interpersonal, when you talk about the other person, the client may get upset, and he may shout, he may do so many things. So he should be able to manage the emotions of the client. Sometimes you should be able to manage the emotions and anger of the client. So these are the skills required for interpersonal counselor. So what are the techniques which we use in interpersonal counseling or interpersonal therapy? Again, we use therapy, means you go to all the techniques we studied earlier. Behavioral therapy, cognitive behavioral therapy, cognitive therapy, psychotherapy. All the therapies we use, and psychoeducation. These are the only things. What therapies means only those things. Psychotherapy means psychoeducation. Psychoeducation, behavioral therapy, cognitive therapy, and psychotherapy, psychoanalytical therapy. Then I will tell you what are the problems you will come across in interpersonal. What are the types of problems you will come across in interpersonal therapies? What type of problems the client experiences? Unresolved grief. Unresolved grief in interpersonal relationships. Role disputes. Role transmission. Transmission of roles also creates lot of problems. And interpersonal deficits. These are the main areas of problems you will come across in interpersonal counseling. I think I have covered a lot of things about interpersonal counseling. So the steps I have covered, the objectives I have covered, the techniques I have covered, what are the special things the counselors should develop, all this I covered. So I think you are clear about what interpersonal counseling is. Now we are coming to the counseling of children. So usually the counseling of children, in the, I think in the first paper or second paper, you had all the disorders, mental disorders of children. Somewhere learning disabilities. We used to have counseling where you have to do is for children. It is on learning disabilities. In learning disabilities, what do you find? Sometimes they used to repeat the same letter. They miss the letter. They are not able to identify the difference between D and B. Like that, there are so many defects. Some people, they cannot read. They cannot read. They cannot write. They miss while reading. N number of more than 300 or 1000 learning disabilities are there. So these are the problems with which the children used to feel. For counseling, they used to come. For learning disabilities, the other things you might be knowing: ADHD, attention deficit hyperactive disorder. ADHD. This is a very common disorder at present times. People used to come for counseling for ADHD. What are the characteristics of ADHD? Is attention deficit. They cannot focus, they cannot concentrate on one thing. For a second, they'll come to the They will just change to other, change to other. They cannot focus on thing. Unless you focus, you can't learn anything. They can't do anything. They will skip. They do this one little bit. They do to other. Attention deficit is one thing. Even in the class, they can look the teacher once, immediately they go to the other, their attention catches the other things. So attention deficit and hyperactivity, they are very active. The ADHD, the number of ADHD children are quite increasing nowadays. అంటే కొంతమంది మావాడు చాలా యాక్టివ్ అండి అంటున్నాడు. దిస్ ఇస్ నాట్ యాక్టివ్నెస్. ఏడిహెచ్డి ఈస్ బీయింగ్ మిస్ఇంటర్ప్రిటెడ్. చాలా చురుకైన వాడు, చురుకుతనం కాదు ఇది. అటెన్షన్ డెఫిసిట్స్ అండ్ హైపర్ యాక్టివిటీ. దే కాంట్ స్టాండ్ ఇన్ వన్ ప్లేస్. దే కాంట్ సిట్. దే కాంట్ స్టాండ్. They will go on moving, unnecessarily movement they will make. And because of this hyperactivity, their brain is also thinking fastly, quickly, this and that, this and that. So because of that, the confusion arises. They can't focus. They can't do well in the examinations, in the learning. They can't learn anything because of this hyperactivity. Usually, this ADHD is caused by biological, genetical reasons, or by psychological or social reasons. Like environmental reasons are also there. And there is also one theory, which is how much I don't know, because of the the stressful experiences of the mother during pregnancy. The child is earlier, in olden days, the mother was kept peacefully while she was during pregnancy. ఈ రోజు పరిగెత్తాము, ఆఫీసులకు వెళ్తున్నాము, డెడ్ లైన్స్, స్ట్రెస్ఫుల్ కండిషన్స్, ఆల్ దిస్ ద మదర్ ఈజ్ ఎక్స్పీరియన్సింగ్. చివర్లో లీవ్ పెట్టుకుందాం, లీవ్ సేవ్ చేసుకుందాం. బికాస్ ఆఫ్ ఆల్ దిస్ వీఆర్ డెవలపింగ్ లాట్ ఆఫ్ అడ్రినాలిన్ because of deadlines and time bound programs and hadaavadi. This adrenaline being secreted to the child, and he will become hyperactive, and he is becoming problematic. So this is the one theory which is which that the research also proved that. ఎందుకంటే through umbilical cord, this adrenal, because this is an endocrine gland, it flows to the adrenaline, flows into the child. This is one theory. So whatever is that, the ADHD is increasing in the population. Environmental factors, we are giving lot of stimulation to the child. ఒక రూమ్ నిండా బొమ్మలు, వాడిని అక్కడ కూర్చోబెడుతున్నావు, దేని మీద ఫోకస్ చేస్తాడు వాడు? హిస్ జస్ట్ మూవింగ్. దిస్ ఇస్ ADHD is being learnt in the home itself. ఒక బొమ్మ ఉంటే దాని మీద ఫోకస్ చేస్తాడు, నువ్వు 100 బొమ్మలు పెట్టి మధ్యలో వాడిని కూర్చోబెడుతున్నావు. ఎవ్రీథింగ్ ఇస్ వెరీ ఇంట్రెస్టింగ్. సో దిస్ ఆర్ లెర్నింగ్ ADHD. నేర్చుకుంటున్నా అంటే ఏం చేయాలో తెలియక అన్నిటి మీద ఫోకస్ చేయడం వల్ల ఈజ్ లూజింగ్ హిస్ ఫోకస్ అండ్ కాన్సన్ట్రేషన్. దిస్ ఇస్ ఎన్వైరన్మెంటల్ ఫ్యాక్టర్స్, genetical factors, and during pregnancy, mother condition, all these are contributing factors for increasing ADHD children in the present society. So what to do? This is one disorder, and anxiety disorders are more for children, and behavioral disorders like sleepwalk, tics, autism spectrum of disorders. So in the early stage, you might be knowing about tics. Tics means sudden movements of hands, or tics ante entante ఎట్లా చెప్తామంటే they move their it is a neural disturbance. They move there because in the young age, they used to early stage, infant stage and babyhood stage, neural stabilization has not occurred. They used to have tics. Tics is one neurological disorder. And the other thing is sleepwalk, autism spectrum.
Small jets, madam.
Yes.
Small
jets. Yes. Small jets. The infant stage, you will find small jets because there is not stabilization of neural system. And autism is very prevalent nowadays. Spectrum of autism disorders. Autism is where it is both genetical and it's not being said as environmental, biological and genetical mostly. And even today, they are not able to find the exact reason for autism, but the autistic children are increasing. There are so many, even International Autistic Day is also there, and this is more prevalent. Even in India, the number is increasing. I don't know, somebody is there is some research which says that because of the pollution, whatever is that, autistic children means, you might be knowing about what is autism. They are away from most of the time social isolation. They like, they don't want to mix with people, they want to be alone. And autism sometimes will be coupled with mental retardation also, most of the times mild mental retardation autism couple అవుతాయి. సో స్పీచ్ ప్రాబ్లమ్స్ ఉంటాయి ఆటిస్టిజంలో, స్పీచ్ ప్రాబ్లమ్స్ ఉంటాయి, సమ్టైమ్స్ మైల్డ్ మెంటల్ రిటార్డేషన్, సమ్టైమ్స్ ఆటిజం కపుల్డ్ విత్ ఈవెన్ ద మేజర్ మెంటల్ రిటార్డేషన్. అయితే దీనికి ఇది వస్తే ఆటిజం ఉంటే మెంటల్ రిటార్డేషన్ ఉండాలని ఎక్కడా లేదు. దెర్ ఆర్ నెంబర్ ఆఫ్ ఆటిస్టిక్ చిల్డ్రన్ హూ హ్యాస్ బికమ్ ఏ బిగ్ సైంటిస్ట్. సోషల్ ఐసోలేషన్, వాళ్ళు ఎవరితో కలవరు అంతే, వాళ్ళకి ఇంటెలెక్చువల్లీ దే ఆర్ గుడ్, బట్ దే డోంట్ వాంట్ టు మిక్స్. బికాస్ ఆఫ్ దట్, బికాస్ ఆఫ్ ద సోషల్ ఇంటరాక్షన్ ఎప్పుడైతే lacking, because of that lacking of social interaction, they cannot develop the social skills which are required. And in the childhood and babyhood, most of the skills of life we learn through play and with interaction with other children, which is lacking in this autistic children. So there are number of what I can say interventions, were hundreds of interventions were developed, especially to improve the speech, to improve the social skills. యూజువల్గా వీళ్ళకి ఏడిహెచ్డి అండ్ ఆటిజం మిక్స్ అయి ఉంటుంది ఎక్కువగా. ఏడిహెచ్డిని తగ్గించడానికి వీటికి ఎక్కువ మంది ఆర్టిస్టిక్ లో ఏడిహెచ్డి కూడా కపుల్ అయి ఉంటుంది కాబట్టి, సో దిస్ దెర్ ఈస్ లాట్ ఆఫ్ ఇంటర్వెన్షన్, దెర్ ఆర్ లాట్ ఆఫ్ many centers emerged who are taking some interventions to bring about some changes in the behavior of the individual. We don't say that there is cure, we can improve their activity, improve their activity. ఆటిజం ఒక్కోసారి ఏంటంటే మైల్డ్ లెవెల్లో ఉంటే అసలు ఇట్ ఈస్ నాట్ నోటీసబుల్ ఎట్ ఆల్. వాడు ఎవరితో కలవడు, రిజర్వ్డ్ గా ఉంటాడంటాం, అంతే అయిపోయింది. ఈవెన్ దో హీ ఈజ్ ఆర్టిస్టిక్, he will do his work, he is intelligent, except this everything is normal. So if the autism is severe and if it is coupled with ADHD, then it creates lot of, or mental retardation, it creates lot of problems. And usually speech therapy is very much needed for these autistic children, because isolate speech ఎలా నేర్చుకుంటాం, ఇప్పుడు చూసి నేర్చుకుంటాం, ఇమిటేటివ్ గా వస్తుంది స్పీచ్, because they are isolated, they can't they don't know how to, they don't learn to speak. అందుకని ఇది, సో ఎర్లీ ఐడెంటిఫికేషన్, పీపుల్ ఆర్ సేయింగ్ దట్ ఎర్లీ ఐడెంటిఫికేషన్ డెఫినెట్లీ helps. Here the psychology counselors are working in the interventions of all these artistic centers అన్నిట్లో కూడా there are behavioral modification techniques which are being used. చాలా ఆర్టిస్టిక్ సెంటర్స్ డెవలప్ అయినాయి ఇప్పుడు, ఎందుకంటే ది నంబర్ ఈజ్ ఇంక్రీజింగ్. ఇక్కడ అందరు సైకాలజిస్టులు బిహేవియరల్ మాడిఫికేషన్ టెక్నిక్స్ యూజ్ చేస్తారు, ఇంటర్వెన్షన్స్ యూజ్ చేస్తారు. ఇఫ్ యూ హ్యావ్ అన్ ఆపర్చునిటీ, దెర్ ఆర్ నెంబర్ ఆఫ్, విజయవాడ ఆల్సో దెర్ ఆర్ దేర్, హైదరాబాద్, అండ్ నెంబర్ ఆఫ్ థింగ్స్ ఆర్ దేర్. You can visit and you can find out how these people are treated, how they are, these are the activities to bring about behavior modifications along with the counselors. These are called as counselors only, and they use, majority of the time they use play therapy. Play therapy is the main technique which is used for all these disorders with children. Children disorders లో ఎక్కువ ప్లే థెరపీనే యూజ్ చేస్తారు. Yes, this is about counseling for children. Then coming to the counseling for adolescents. Lot of need for counseling the adolescents at the present time due to the changing technological scenario which is existing in the society. We need lot of counseling for adolescents. So ఎలా ఉందంటే ఇప్పుడు, బికాస్ ఆఫ్ వాట్ ఎవర్ ఈస్ దట్ because of globalization or whatever is that, and the technological developments, and due to corona, people used to this type of more technological gadgets which are creating positive as well as negative impact on the adolescents. Positive as well as negative impact there, because the knowledge is at their hands. So this is creating lot of problems. So they are also experiencing lot of problems, addictions. Because of addictions they're feeling lot of problems. Here, how a counselor has to help them, an adolescent, is self awareness. This is important. Self awareness. They know the abilities what they are having. They know about their they should be strengths. Now that's why in psychology we are going into the strength based counseling is very much useful to adolescents. Strength based counseling, this is positive counseling. Identify, you said you will ask them what are your strengths. నీ ప్రాబ్లమ్స్ ఏంటంటే హెసిటేట్ చేస్తారు అడలసెంట్ ని. నీ స్ట్రెంగ్త్ ఏవో అడగండి. డోంట్ థింక్ అబౌట్ యువర్ ప్రాబ్లమ్స్, focus on your strengths and improve your strengths. If you improve your strengths, automatically the negative things will come into background. Okay, so this is the major thing which we have to use for adolescent counseling, helping them in self awareness. వాళ్ళు ఏం చేస్తున్నారో వాళ్ళకి తెలియజెప్పాలి ముందు. అండ్ సెల్ఫ్ ఎఫికసీ. వాట్ ఈస్ సెల్ఫ్ ఎఫికసీ? Self efficacy and self awareness are different. Self efficacy is I am having the skills and also I know that I am having the skills. This is important. Knowing that I am having the skills is efficacy. నా స్కిల్స్ ఉన్నాయి కానీ ఐ డోంట్ నో దట్ ఐ కెన్ డూ దిస్. నాకు అది పని చెయ్యగలను అనే కాన్ఫిడెన్స్ లేకపోతే నేను నాకు ఎబిలిటీస్ ఉన్నా నేను పోను ఆ పనికి. సో సెల్ఫ్ ఎఫికసీ ఈజ్ హ్యావింగ్ ద స్కిల్స్, knowing that I am having the skills and then I am presenting the skills. I can do this అనేటువంటి ఒక కాన్ఫిడెన్స్ నా స్కిల్స్ గురించినటువంటి నా ఎబిలిటీస్ గురించి నాకుంటే నేను ఐ కెన్ గో ఫార్వర్డ్ అండ్ ఐ కెన్ డూ దట్. నేను ఇది చేయలేనండి అది చేయలేనండి అంటాం. యామ్ ఐ ట్రైడ్ ఎట్ ఎనీ టైమ్? నో, బట్ ఐ ఫీల్ దట్ ఐ కెనాట్ డూ దట్. సో ఇక్కడ సెల్ఫ్ ఎఫికసీ అంటే సో ఫీలింగ్ దట్ ఐఎమ్ having the strengths and I know that I am having the strengths. So this is one thing, self awareness, bringing about self awareness and self efficacy. And thirdly, to come out from self defeating behaviors. Coming out of self defeating, these are the three areas. Depending upon the problem we have to go in detail. ఈ 3 ఏరియాస్ అడలసెంట్ కౌన్సిలింగ్ లో మనం చూసుకోవాలి. పాజిటివ్ గానే పోవాలి. అండ్ ఐడెంటిఫైయింగ్ అండ్ టు కమ్ అవుట్ ఫ్రమ్ ద సెల్ఫ్ డిఫీటింగ్ బిహేవియర్స్. సో దిస్ ఇస్ అబౌట్ ద థింగ్. దెన్ కమింగ్ టు ద థర్డ్ పార్ట్ ఆఫ్ దట్ థర్డ్ బుక్. ఇస్ ఇట్ ద థర్డ్ బుక్? This is about again I think this is in this thing, interpersonal counseling, interpersonal techniques, all this we covered. And counseling children, most of the time we treat the children with behavioral therapy only. We go for play therapy, play therapy and behavioral therapies, because cognitive therapies they cannot understand. So cognition may not work at the childhood level. So we go for do this behavioral therapies or positive reinforcement therapies like that, and then we go for play therapies. So they learn so many things through play. So let us use the play therapies for childhood problems in counseling. So let us come to the third book, that is on behavior modifications. So as you know, psychology is the study of scientific systematic study of behavior. What is behavior? Means everything is behavior. Every action is behavior. So what is the goal of psychology? Is bringing about behavior modifications. Why should you bring modifications in the behavior? ఎందుకు మార్పు ఎందుకు తీసుకురావాలి? బిహేవియర్ మాడిఫికేషన్స్ ఎందుకు చేయాలి? Why should we do behavior modification? Because there are certain behaviors which are what I can say that which are hindering our growth. There are certain behaviors which are creating problems. That's why you have to modify the behaviors, right? So in this behavior modifications, there are certain principles of behavior modification. I told you this behavior modification basically depends on the concepts of behavioral therapy. Behavioral therapy. I said behavioral approach towards psychology. Behavioral therapy kaadu, behavioral approach. In the behavioral approach, there are 3 points you have to remember. One is behavioral therapy is like allopathy. There are SR relationships. SR, stimulus response, means reason, effect, cause and effect. Cause and effect. Cause and effect. What do you find first, cause or effect? What do you find first? Huh? Cause or effect?
First cause, madam. Cause.
Effect.
Cause or effect?
Cause only
Okay,
first.
let me give you an example. First thing, the cancer, the disease cancer is more prevalent. Then people try to find the causative factors for this cancer.
Yes, causative factor.
ఎప్పుడు ముందు ఎఫెక్ట్ కనిపించింది, క్యాన్సర్ కనిపించింది. అడిక్షన్స్, పిల్లలందరూ అడిక్షన్స్కి ఇప్పుడు గ్యాంబ్లింగ్ అండి, వీడియో గేమ్స్ కానీ ఎఫెక్ట్ కనిపిస్తోంది. దెన్ వీఆర్ థింకింగ్ అబౌట్ ద కాజ్. వై దిస్ ముందు ఎఫెక్ట్ కనిపిస్తోంది. ఎన్వైరన్మెంట్ అంతా పొల్యూట్ అయిపోయి, ఎన్వైరన్మెంట్ అంతా వీఆర్ ఇర్రెగ్యులర్లీ, ఎన్వైరన్మెంట్ ఇస్ వాట్ ఈస్ వీఆర్ ఎక్స్పీరియన్సింగ్. దెన్ వీఆర్ థింకింగ్ అబౌట్ కాజెస్. ఏదో పొల్యూషన్ అనో ఏదో కాజ్, మనం ఏదో చెబుతున్నాం, ఓజోన్ లేదో ఏదో సంథింగ్ కాజ్. సో ఆల్వేస్ ద ఎఫెక్ట్ కమ్స్. మన దగ్గరికి ట్రీట్మెంట్కి ఎఫెక్ట్తో వస్తున్నాడు. వీ హ్యావ్ టు అనలైజ్ ద కాజ్ అండ్ ట్రీట్ హిమ్. సిమిలర్లీ ద బిహేవియరిస్టిక్ సైకాలజీ ఆల్వేస్ థింక్స్ అబౌట్ ఏ బిహేవియర్కైనా కారణం లేకుండా ఏం జరగదు అనేది ప్రిన్సిపల్ వాడదు. నువ్వు బాగా చేస్తున్నావంటే దెర్ మస్ట్ బి సమ్ రీజన్. బాగా చేయట్లేదు అంటే దెర్ మస్ట్ బి సమ్ రీజన్. ఫర్ బోత్ దెర్ మస్ట్ బి సమ్ రీజన్. This is the idea of behavioristic approach. For everything there is a reason. There is a reason. If you are able to find out the reason, we can bring about modifications in the behavior of the individual. This is the concept of behavioristic psychologist. And the second concept of behavioristic psychologist is that everything is learned only. ఇప్పుడు మనం అడిక్షన్ కూడా లర్న్డేగా, అది పుట్టుకతో రాలేదుగా, మనకి బై బర్త్ రాలేదుగా. లర్న్డ్, ఎవ్రీథింగ్ ఈజ్ లర్న్డ్. ఎవ్రీ యాక్షన్, యూ లర్న్ టు డ్రెస్ అప్, యూ లర్న్ టు ఈట్, యూ లర్న్ టు కుక్, యూ లర్న్ టు లర్న్. ఎవ్రీథింగ్ ఈజ్ లర్న్డ్ బిహేవియర్ ఎక్సెప్ట్ ద ఇన్బార్న్ ఇన్స్టింక్ట్స్. Except the instincts, everything is learned. This is the second concept. If you learn properly, if your learning process is suitable, what I can say that correct, then you will behave in a correct fashion. If you learned wrong things, then you will have problems. You have learned things which are required for life. ఏం కావాలి లైఫ్కి? డెసిషన్ మేకింగ్ కావాలి, ఉట్నే జనరల్గా డెసిషన్ మేకింగ్ కావాలి, కమ్యూనికేషన్ కావాలి. ఆల్ దిస్ వీ నీడ్. I have learned all the things. But in a wrong way. So learning wrong way లో జరిగితే it is creating problems. I am making always wrong decisions. I know how to make decisions, but I am making the decision making process I have learned is a wrong process. Okay, that's why every time I am having experiencing a failure. I learned communication, but wherever I used to speak with anybody, I am getting a problem. అంటే ఏంటి, నాకు మాట్లాడడం వచ్చు కానీ ఎవరితో మాట్లాడినా గోలే. దట్ మీన్స్ ఐ లెర్న్డ్ కమ్యూనికేషన్, but I learned the communication process in a wrong fashion. That's why I am getting problems with interpersonal problems. Right? Third thing, I have not at all learned communication. రాంగ్ కాదు, రైట్ కాదు, అసలు ఆ పదే రాదు, నాకు నాకు అది చేత కాదండి అన్నాను. నాకు సోషల్ బిహేవియర్ రాదండి అన్నాను. ఇట్ ఈస్ క్రియేటింగ్ ప్రాబ్లమ్స్. సో నాట్ లెర్నింగ్ ఈజ్ వన్ ఆస్పెక్ట్ ఫర్ క్రియేటింగ్ ప్రాబ్లమ్స్. I have learned but in a wrong way. So according to behaviorists, learning is the only important thing for learning is the causative factor for all our behavioral problems. So if you cause, ఇది లెర్నింగే కాజ్ అంటున్నాడు, ఈ కాజ్ అని కానీ ఈ లెర్నింగ్ లో కానీ స్కిల్స్ లెర్నింగ్ లో కానీ మార్పు తీసుకొస్తే వీ కెన్ సాల్వ్ ద ప్రాబ్లమ్స్. అందుకని సోషల్ స్కిల్ లెర్నింగ్, communication skill learning, all assertiveness learning, all skill learning process are given in the counseling aspects of behavioral therapy. బిహేవియర్ మోడిఫికేషన్ లో అన్ని స్కిల్ లెర్నింగ్ వాళ్ళు ఎక్కువ పెట్టారు. దీంతో పాటు బిహేవియరిస్టిక్ థియరీ ఈజ్ ఫోకస్డ్ ఆన్ అపరెంట్ లెర్నింగ్ ఆర్ ఇన్స్ట్రుమెంటల్ లెర్నింగ్ కండిషనింగ్. దర్ ఇస్ థియరీ బై స్కిన్నర్. What the third thing what they have proposed is, for all the behaviors which were given positive reinforcement are repeated again and again. నాకు ఏ బిహేవియర్ కి అయితే పాజిటివ్ రీఇన్ఫోర్స్మెంట్ వస్తుందో ఆ బిహేవియర్ ని నేను రిపీట్ చేస్తా. whenever I get a negative reinforcement like punishment, then I stop doing that. So if you want to promote one behavior, you have to give positive reinforcement. If you want to stop one behavior, you have got to give punishment. Yes, this is aversion therapy antam. Punishment ichedi aversion therapy. You are creating punishment and stopping the behavior. Like addictions lo istaru chudandi, meeku andariki telusu. Alcoholic addictions lo, to bring them de-addiction clinics lo vallu aversion therapy istaru. When they take along with what is that, they are habituated for alcohol, along with that they will give some of the medicines which creates lot of nausea in the stomach. వాళ్ళకి ఏంటంటే ఆల్కహాల్ చూడంగానే ఆ నాజియా గుర్తొచ్చి దే స్టాప్ టేకింగ్ దట్ అవర్షన్ థెరపీ. సో దే డూ దట్ ఆల్సో. ఈ అసెస్మెంట్ మొత్తం చాలా రకాలు ఇస్తారు, ఒక్క థెరపీయే కాదు. నేను అవర్షన్ అనడానికి చెప్తున్నాను ఎగ్జాంపుల్ అంతే. దట్స్ నాట్ ద ఓన్లీ థెరపీ ఫర్ డి అడిక్షన్. దిస్ ఈస్ వన్ ఆఫ్ ద థెరపీస్. So when you are having a negative punishment, then you stop that behavior. Okay. So he used in apparent conditioning, used positive reinforcement techniques. These are the important technique which we use in behavior modification of a person in counseling లో. వాళ్ళకి పాజిటివ్ రీఇన్ఫోర్స్మెంట్ ఇచ్చే కొద్దీ ఆ బిహేవియర్, దిస్ ఇస్ ద concept of behavioristic psychologist. So we will bring about behavior modifications by providing positive reinforcement, and similarly systematic desensitization and aversive conditioning. I told you in the addiction case, aversive negative conditioning. And sometimes for children they used to give token economy, tokens. For whatever good thing you do, I will give you a token. For everything, if you get so many tokens, I am going to get this. Okay, this is called token economy. Which all this, if they did a bad thing, the tokens will be minus. That a good thing, tokens will be added. By that, we will bring about behavior modifications in children. So this is about behavioral modification. Again, he has given the approaches and techniques of behavioral modification only. Okay. So then he has given about the cognitive things. Cognitive what are the reasons about cognitive things is, I told you, you remember it forever. Cognitive, the word cognitive means these are the higher mental abilities, which includes cognition is understanding of things with the help of four aspects. Your thinking plays a role in understanding. Your intelligence plays a role in understanding. Your learning plays a role in understanding. Thinking, learning, perception. Fourth one is perception. Good. All the four together make us to understand a issue or understand a event or whatever is that. Your understanding is based on all these things. So, if there is if you are having irrational irrational thinking, it has an impact on your behavior. So, these are some of the things because of the defects in thinking, learning, perception, and uh, intelligence. They will make some of the errors. The basic errors are irrational thinking is one error, and the second thing is overgeneralization. People, this is cognition, they make overgeneralization. Generalization is okay. If it is over, that creates a problem. Overgeneralization.
Madam, can you explain what is overgeneralization?
Yes. Overgeneralization means, suppose I will tell you regarding recent experience of corona. Let me say that I got it. Corona. So they said these are the symptoms of corona. So many impressions, so many things we learned, we observed, we are getting from WhatsApp, whatever is that. So because of that, when you see a person, we are generalizing some of the things. Generalization is okay. If it is over, suppose I will take some more another example also. Cholera. Somebody got cholera and cholera is prevalent. Somebody says that if you are having 2 times or 3 times motion, then immediately we will generalize it and we will say it is cholera. Now people are saying that if you are having a cyst, it is cancerous. So generalization is okay. If you over generalize for everything, then it creates a lot of problem to us. Over generalization, particular category of people behave like this. We will generalize that to everybody. Then that creates lot of problems, sometimes social problems, family problems, like that. So this overgeneralization is one of the reasons. Cognitive, this is a cognitive activity. This, because of the knowledge we are having, usually we will generalize, but if it is more extensive generalization. Sir, I think you got that. Okay.
Thank you, ma'am. Thank you.
Yes. This overgeneralization, sometimes we used to overgeneralize things and create problems to ourselves. This is one thing. Then
Can I give one example regarding this, ma'am? I don't know whether this is particularly comes under the category or not. Yesterday, I met with one person. His father recently died due to the cardiac arrest, ma'am, while driving. That's why the student completely stopped to do the driving. He hired one driver for him. Is it comes under?
No. It won't come. It is because of the event which occurred. He has learned. He developed a phobia immediately after that. He learned the phobia. This, you might be knowing that. What is that? What is that? This phobia. Immediately, I can say that it is a phobia. It's an irrational thing. Phobia. Suppose sometimes if I drive, I may get this, like that, and it usually after some time it fades away. This immediately the person will give it. When I was in a train and I met with an accident, I don't want to get into the train again for 1 year. After that, I will go. So this is an immediate reaction for that. This is not overgeneralization. That is not overgeneralization.
Okay, thank you.
Yes, yes. So this is then there are mental filters we are having. Cognitive mental filters means, what are mental filters? Sometimes when you are having a knowledge, you know something, while you are telling that information to other person, you don't give the full information. You will filter some of the things. You will keep something for yourself, and you will sometimes knowingly, sometimes unknowingly also. You will say some information, overall information only. So because of this mental filters also creates some of the relationship problems. Mental filters, especially in couple counseling, all this, because of this mental filters, not totally open to others. Like that, I can say that. Not totally open. So in relations, close relations, it is expected they should be open to each other, like that in the family relations. So if you are using some mental filter, you will develop some suspicion, and it creates it's not this mental filter is mainly responsible for this cognitive problem, relationship problem. So I'm not revealing everything. I kept something for myself, and I am revealing only some part of that. So these are called as mental filters. All this happens frequently, continuously. Sometimes it happens to, if it will become, it will be justified and they don't need the counseling. Sometimes if it is more number of time, it creates relationship problems, whether it is an office or wherever it is, relationship problems. They don't believe you. They don't believe you. And it creates some conflicts and other interpersonal problems. Mental filters, because of the mental filters. So because we are suspicious, we don't want to reveal. ఏమవుతుందేమో చెప్పేస్తే ఏమో అని ఆగుతాం, అంత చెప్పం, కొంచెం చెప్తాం. కొంచెం కూడా బికాస్ ఇట్ ఈస్ నీడెడ్. లేకపోతే చెప్పడం ఇష్టం లేదు, కానీ చెప్పాలి కదా, చెప్పలేదంటారేమో అని కొంచెం చెప్తాం. సగం ఫిల్టర్ చేసేసాం అక్కడే. Which they don't, sometimes we filter some of the information to maintain the relationships. We'll do some filter certain things. It is a positive way. రిలేషన్షిప్ లో ఏం హామ్ లేకుండా ఉండడం కోసం, మెయింటైన్ చేయడం కోసం కొంచెం ఫిల్టర్ చేస్తాం. అండ్ డిస్టెంట్ రిలేషన్స్ ఇట్ ఈస్ ఓకే, బట్ ఇఫ్ ఇన్ క్లోజ్ రిలేషన్స్, ఇఫ్ మెంటల్ ఫిల్టరింగ్ ఈస్ దేర్, then the suspicion develops. That is one of the, with no reason, we will filter with no reason. So then disqualifying the positive things. ఎవరన్నా చేస్తారులేండి అంట, వాళ్ళు ఎవరన్నా పాజిటివ్ థింగ్స్ చేస్తే అదేం పెద్ద ఇదా, ఎవరన్నా చేయొచ్చు. విల్ రెడ్యూస్ దట్ ఇంపాక్ట్ ఆఫ్ దట్ అండ్ డిస్క్వాలిఫైయింగ్ ద పాజిటివ్. ఇప్పుడు నువ్వు ఏదన్నా బాగా అచీవ్ చేసినప్పుడు ఏదో చేసావులే అంటే, హౌ డు యూ ఫీల్? కంటిన్యూస్లీ ఇఫ్ యూ డూ లైక్ దట్, సంబడీ డూస్ లైక్, most of the things, all this creates interpersonal problems. Interpersonal relationship problems, so all this will help. And then jumping to conclusions. Usually we will do, if you have a small hint, we will jump into conclusion. So all these are the this is magnification and minimization. ఆ ఉన్న ఈవెంట్ ని మ్యాగ్నిఫై చేయడం, లేకపోతే ఉన్న ఈవెంట్ ని మినిమైజ్ చేయడం. These are the two things which we are doing in overgeneralization or whatever is that. These will create cognitive problems which are responsible for all our mental disorders అనలేం మనం పూర్తిగా. Some of the minor mental disorders like anxiety, like interpersonal conflicts, for all these things, these are the our behavioral aspects which are responsible, our way of thinking, our cognitive processes. All these are the cognitive processes, what I told you. All these cognitive processes are responsible for creating problems. So for all the cognitive process, what are the techniques? We had a discussion of all the techniques earlier. Cognitive behavioristic psychology, cognitive psychology. We had the thing validity testing, means with evidence. So make the individual to understand. Here in what is the cognitive uh, counseling is, in cognitive counseling, through all these first step, rapport building, relationship building and problem identification, the counselor identifies where is the cognitive distortion, ekkadundo cognitive distortion identify చేస్తాడు. అంతేగా, ఎక్కడ ప్రాబ్లం ఉందో ఐడెంటిఫై చేస్తాడు కౌన్సిలర్. ద ప్రిలిమినరీ మీటింగ్ అండ్ త్రూ అసెస్మెంట్ and through interview and all the things, and both of them will come across with the problem identification జరిగిన తర్వాత ఈ ప్రాబ్లమ్ ని మనము అడ్రస్ చేయడానికి what do you do in addressing the problem? So in addressing this problem, what do you do? One is validity testing. Validity testing ante we want to change all these four, either his thinking process. If the problem is in his thinking process, we will try to change his thinking process. If the problem is in his perception, we will try to reorient his perception. If the problem is in his learning, we will try to unlearn those things and learn the new things. So ఎక్కడ ప్రాబ్లం ఉందో ఈ ఫస్ట్ స్టెప్ లోనే కౌన్సిలింగ్ లో అండర్స్టాండ్ చేసుకుంటాం. చేసుకున్న తర్వాత we have to do validity testing. So we will ask them, support if they say this is the person doing so many things, that's why I hate the person. Then reality testing. We will give the supportive evidences. We will ask for supportive evidences like that. And sometimes guided discovery. We will ask continuous questions. The counselor asks guided discovery is asking the series of questions to introspect himself and find out the reason by himself. Asking series of questions is called guided discovery. This is a technique used in cognitive counseling. And journal writing. Ask the person to write the journal. How many times today the particular person has developed this? If you want to bring about changes, how many times today, next time, suppose like anger management or like having the irrational thoughts, how many irrational thoughts you got today? You think irrational, and second day reducing them. Like that, journal writing is another method. And REBT, yesterday I told you about this REBT also. Rational emotive therapy is also one of the cognitive therapies which are used. And then we are coming to the, where do you use this cognitive therapies? Where do you use this type of cognitive therapies for behavior modification? Cognitive techniques for behavior modification. I told you about the behavioristic techniques for behavior modification and the cognitive techniques for behavior modification. Where do you use? We can use in educational settings. We can use them in clinical settings, and we can use them in personal level or in social situation. You can use this cognitive techniques. Cognitive techniques in we can use them. So we are having behavioristic techniques, cognitive techniques. Now we are going into the cognitive behavioristic modification techniques, both together. Cognitive behavioristic modification techniques. There are three. First, I told you about behavioristic modification techniques. Second is about the cognitive modification techniques. Cognitive behavior modification. All these are the behavior modification techniques only. Cognitive behavior modification. And now we are going to cognitive behavioristic modification techniques. This is first thing is self-instructional technique. Self-instructional technique. This is one way is introspecting. Healthy self-talk. Developing healthy self-talk. Self-instructional technique. Technique means intervention. This is the procedure what we are using to bring about modification. This procedure is called as intervention. Here in most of the time we use this as technique and a word used as. Technique means intervention. First instructional technique is healthy lifestyle talk. This will make the client through ఇందాక నేర్చుకున్నవన్నీ బిహేవియరిస్ట్ కాగ్నిటివ్ టెక్నిక్స్తో మనం విల్ బ్రింగ్ దెమ్ సెల్ఫ్ అవేర్నెస్. దిస్ ఇస్ వన్ మెథడ్. సెల్ఫ్ ఇన్స్ట్రక్షనల్ టెక్నిక్. ది ఇండివిజువల్ హిమ్సెల్ఫ్ ఇన్స్ట్రక్ట్స్ ఇన్ త్రూ హిస్ సెల్ఫ్ టాక్. He is asked to say something. We will correct it, we will facilitate it, we will change it, we will modify it, and the individual himself make the instruction. This is the self-instructional. He himself instructs himself. Then stress inoculation techniques. Stress inoculation techniques, SIT. These are like vaccinations. Stress inoculation techniques are like vaccinations. Why do you take a vaccination? It is against disease. You take vaccination against a disease. Similarly, prevention. Similarly, stress inoculation is also a training helps a person against stressors. Again, where we use it to prevent disease, here also to prevent stressors. We use the stress inoculation training. Here in this first stage is stress inoculation, just treatment technique. What we use is the first step is they have to identify the stressors. First time, this is called as a conceptual education, where the individual has to identify the stressors. Stress inoculation. Then ఏవి స్ట్రెస్ క్రియేట్ చేస్తున్నాయి నాకు? ఈజ్ ఇట్ ద ఓవర్ వర్క్? ఈజ్ ఇట్ మై ఫిజికల్ వీక్నెస్? ఈజ్ ఇట్ మై వాట్ ఐ కెన్ సే దట్ ఈజ్ ఇట్ మై థాట్స్? దేనివల్ల స్ట్రెస్ ఫీల్ అవుతున్నాను అనేది ఈ స్ట్రెస్సార్స్ ఐడెంటిఫై చేయాలి. ఏంటి నా స్ట్రెస్సార్స్? వై ఐ ఆమ్ ఫీలింగ్ లైక్ దిస్? ఈ ల్యాక్ ఆఫ్ స్కిల్స్ ఆల్సో క్రియేట్స్ లాట్ ఆఫ్ స్ట్రెస్. నన్ను ఈ పని చేయమన్నారు ఆఫీస్లో, నాకు ఆ పని చేయడం రాదు. నువ్వు వెళ్ళి ఈ టాపిక్ చెప్పు అన్నారు, ఆ టాపిక్ నాకు రాదు. ఐ హ్యావ్ టు గో అండ్ డూ దట్. దట్ క్రియేట్స్ లాట్ ఆఫ్ స్ట్రెస్. సో వీటిలో ఏవి స్ట్రెస్సార్స్? ఇఫ్ ఐ లెర్న్ సంథింగ్ ఐ కెన్ కమ్ అవుట్ ఆఫ్ దట్ స్ట్రెస్. రైట్? లెర్నింగ్ సంథింగ్ బ్రింగ్ అప్ మీ అవుట్ ఆఫ్ స్ట్రెస్. కాబట్టి ఫస్ట్ స్టెప్ లో ఏం చేస్తామంటే స్ట్రెస్ ఇనాక్యులేషన్ లో వీ హ్యావ్ టు ఐడెంటిఫై ద స్ట్రెస్సార్స్. ఏవి నాకు ప్రాబ్లం క్రియేట్ చేస్తున్నాయి? వాట్ ఆర్ ద స్ట్రెస్సార్స్? దెన్ లెర్న్ ద స్కిల్స్. స్కిల్ ఎక్విజిషన్. ఆ స్ట్రెస్సార్స్ ని పోగొట్టుకోవడానికి ఐ హ్యావ్ టు లెర్న్ సర్టన్ స్కిల్స్. కొన్నిసార్లు కమ్యూనికేషన్ స్కిల్స్ నేర్చుకోవాలి, కొన్నిసార్లు డెసిషన్ మేకింగ్ స్కిల్స్ లేకపోతే చాలా స్ట్రెస్. ఐ డోంట్ నో వాట్ టు డిసైడ్. ఎప్పుడు స్ట్రెస్ఫుల్లే డెసిషన్ మేకింగ్ లేకపోతే. సో డెసిషన్ మేకింగ్ స్కిల్స్, interpersonal skills. What are the skills which are creating me problem? So the second part of that is వాళ్ళకి స్కిల్ ని acquisition of skills, and the third is application of the skills and follow up. ఇంతే మొత్తం ట్రీట్మెంట్. SIT అంతా ఈజీ. నీ స్ట్రెస్సార్స్ ఏంటో ఐడెంటి. నీకు ఎక్కడెక్కడ ప్రాబ్లం వస్తుంది? దేంట్లో నువ్వు స్ట్రెస్ఫుల్ గా ఫీల్ అవుతున్నావు? ఈజ్ ఇట్ ఇన్ యువర్ ఆఫీస్ వర్క్? బికాస్ ఆఫ్ ది డెడ్ లైన్స్ you're not able to do it quickly? Learn to do it quickly. Learn the techniques. This is the skill you have to learn. లేదా నువ్వు జాబ్ వదిలేసి ఇంకో జాబ్కి వెళ్ళగలవా? వెళ్ళగలిగితే వెళ్ళిపో, లేదంటే స్కిల్స్ నేర్చుకో. నేను వెళ్ళను, ఇక్కడే ఉంటాను, స్కిల్స్ రావంటే ఇట్స్ క్రియేట్ స్కిల్స్. రైట్? సో మోస్ట్ ఆఫ్ ది టైమ్స్ బికాస్ వీ డోంట్, అట్లా చేయడం నాకు చేత కాదండి. చేత కాకపోతే వీ హ్యావ్ టు ఫేస్ ద కాన్సిక్వెన్సెస్. You have to learn or face the consequences. నేను నేర్చుకోను, ఇక్కడి నుంచి వెళ్ళను, స్ట్రెస్ ఫీల్ అవ్వకూడదు అంటే కుదరదు. దట్ ఈస్ ద సిచ్యువేషన్ వేర్ యూ హ్యావ్ టు లెర్న్ అండ్ కమ్ అవుట్ ఆఫ్ ద స్ట్రెస్ Or if there is an opportunity, you can leave and go away and avoid stress. You can avoid stress, you can alter stress, you can accept and learn the skills required. స్ట్రెస్ మేనేజ్మెంట్కి 4 పాయింట్లు చెప్తాం మేము, ఏబిసి అని. ABC. First A is you can avoid or alter or accept. 3 things. You can avoid stress if possible. ఈ స్ట్రెస్ఫుల్ సిచ్యువేషన్ నేను వెళ్ళిపోగలనంటే అవాయిడ్ చేసే. ఈ సిచ్యువేషన్ ఆల్టర్ చేసుకో. అవాయిడ్ చేయడం అంటే రోజు వీళ్ళతో వెళ్ళి మాట్లాడితే గొడవ వస్తుంది. ఐ కెన్ అవాయిడ్ దిస్ పర్సన్. అన్ని చోట్ల అవాయిడ్ చేయడం కుదరదు. యూ విల్ ఆల్టర్ ద పర్సన్ సమ్ టైమ్స్, నాట్ ఆల్వేస్. ఆల్టరేషన్ కూడా కుదరదు అన్ని చోట్ల. ఎట్లా కుదురుతుంది? ఈవెన్ ఇన్ ద ఫ్యామిలీ కుదరదు, ఆఫీస్లో కుదరదు. యూ కాంట్ ఆల్టర్. ఆల్టర్ అంటే చేంజ్ ద పర్సన్ అండ్ యూ కెన్ యాక్సెప్ట్. యూ కెన్ రెడ్యూస్ యువర్ స్ట్రెస్. మోస్ట్ ఆఫ్ ది టైమ్స్ యూ హ్యావ్ టు యాక్సెప్ట్ ఇట్. యాక్సెప్ట్ చేస్తే స్ట్రెస్ ఈస్ క్రియేటింగ్ లాట్ ఆఫ్ హెల్త్ ప్రాబ్లమ్స్ టు మీ. ఏలో 3 ఆస్పెక్ట్స్ చెప్పాను. యూ కెన్ అవాయిడ్, యూ కెన్ ఆల్టర్. ఎదురెళ్ళి స్ట్రెస్ తెచ్చుకోవద్దు. యూ కెన్ అవాయిడ్, యూ కెన్ ఆల్టర్ ఇఫ్ పాసిబుల్, ఆర్ యూ హ్యావ్ టు యాక్సెప్ట్ మోస్ట్ ఆఫ్ ద టైమ్స్. యాక్సెప్ట్ చేసిన తర్వాత దాని ఇంపాక్ట్ మన మీద లేకుండా చూసుకోవాలి, ఒకటి. రెండోది, దానికి కావాల్సిన స్కిల్స్ నేర్చుకోవడం కౌన్సిలింగ్లో నేర్చుకుంటాం. దాని ఇంపాక్ట్ మన హెల్త్ మీద లేకుండా చూసుకోవాలంటే ఏం చేయాలి? నెంబర్ 1 బీకి వచ్చాం. యాక్సెప్ట్ చేసాము, బీకి వచ్చాం. బీలో యూ హ్యావ్ టు బిల్డ్ రెసిస్టెన్సెస్. యూ హ్యావ్ టు బిల్డ్ రెసిస్టెన్సెస్. ఎక్కడ రెసిస్టెన్స్ బిల్డ్ చేయాలి? టైం అయిపోయిందే, చెప్పేసి వదిలేస్తాను. యూ హ్యావ్ టు బిల్డ్ రెసిస్టెన్సెస్. ఏ లెవెల్లో? ఫిజికల్ లెవెల్లో, డూయింగ్ ఎక్సర్సైజ్. అప్పుడు స్ట్రెస్ ఇంపాక్ట్ మన బాడీ మీద ఉండదు. ఫిజికల్ లెవెల్ యూ హ్యావ్ టు డెవలప్ రెసిస్టెన్సెస్. దెన్ అట్ సైకలాజికల్ లెవెల్, అంటే కాగ్నిషన్తో, ఆలోచనతో, ఇంటలెక్చువల్గా దీనికి ఏంటి రెమెడీ అనుకొని స్ట్రెస్ని తగ్గించుకోవడానికి ప్రయత్నం చేయాలి. ఫిజికల్ లెవెల్, సైకలాజికల్ లెవెల్, ఈ 2 కుదరలా. థర్డ్ ఉంది, యూ హ్యావ్ టు టేక్ సోషల్ సపోర్ట్. నేను ఎవరిని అడగని అనకూడదు. యూ హ్యావ్ టు టేక్ ద సపోర్ట్. సోషల్ సపోర్ట్ ఈజ్ వెరీ ఇంపార్టెంట్ టు రెడ్యూస్ అవర్ స్ట్రెస్. మొత్తం పని నేనే చేస్తానండి, నేను ఎవరి సాయం తీసుకోను అంటే యూ విల్ బి స్ట్రెస్ఫుల్. డెడ్ లైన్. మోస్ట్ ఆఫ్ ది టైమ్ ఉమెన్ యూస్ టు డూ దట్. మొత్తం నేనే చేయాలంటాం. మొత్తం నేనే చేస్తే డెడ్ లైన్స్ అందుకోలేవు. ఇట్ ఈస్ స్ట్రెస్ఫుల్ ఫర్ యూ. సో టేక్ సపోర్ట్. థర్డ్ లెవెల్. ఫోర్త్ లెవెల్, స్పిరిచువల్ లెవెల్. ఫిజికల్ లెవెల్, సైకలాజికల్ లెవెల్, social level, spiritual level. All 4 levels you have to build resistances to keep our health, because 75% of the disorders are due to stress. సో ఇవి మెథడ్స్ మేనేజ్మెంట్కి, స్ట్రెస్ మేనేజ్మెంట్కి. ఇవి చెప్పండి వాళ్ళకి చెప్తూ యూ హ్యావ్ టు లెర్న్ ద స్కిల్స్ రిక్వైర్డ్ టు మేనేజ్ ద స్ట్రెస్. ఆ సిచ్యువేషన్స్, ఈ స్కిల్స్ కూడా మనం చేయాల్సి వచ్చింది. సి ఉంది ఒకటి, ఏ బి అయిపోయింది, బిల్డ్ రెసిస్టెన్స్. సి ఉంది, యూ హ్యావ్ టు చేంజ్ యువర్ పర్సెప్షన్. ఇది కాగ్నిటివ్ మెథడ్. చేంజ్ యువర్ పర్సెప్షన్, కాగ్నిటివ్ మెథడ్. ఏంటి చేంజ్ యువర్ పర్సెప్షన్? మామూలుగా మనకి సైన్స్ అందరూ చెప్తుంటారు, నీ దృష్టి మారితే సృష్టి మారుతుంది. కాస్త చూడడం మార్పు చేయి, విజన్ మార్చు, దృష్టి మార్చు, ఎవ్రీథింగ్ విల్ చేంజ్. నాకే ఎందుకు జరిగిందని దృష్టి మారితే సృష్టి మారిపోతుంది. సో దీస్ ఆర్ ది స్ట్రెస్ మేనేజ్మెంట్. దీస్ ఆర్ ది థింగ్స్ విచ్ యూ హ్యావ్ టు డూ టు మేనేజ్ యువర్ స్ట్రెస్. అది అసలు లేదు మీ దాంట్లో, నేను జస్ట్ చెప్తూ ఫ్లోలో వచ్చేసింది. దెన్ సెల్ఫ్ మేనేజ్మెంట్ టెక్నిక్స్ యూ హ్యావ్ టు యూజ్. ఇవన్నీ నేను ఇప్పుడు చెప్పినవన్నీ సెల్ఫ్ మేనేజ్మెంట్. సెల్ఫ్ మేనేజ్మెంట్ స్ట్రాటజీస్ టు రెడ్యూస్ the stress we have to use. Then we have to use some cognitive strategies. So this is about stress self management techniques. These are the self management techniques. And third thing is problem solving techniques. You have to learn problem solving techniques. So all these are the cognitive behavioristic techniques of counseling. Counseling lo manam iche techniques ivanni. cognitive behavioral modification techniques of counseling. The last one we are going to, this is about solution focused therapy. This is also very important. Solution focused therapy. Here, this therapy is on solutions rather than on problem. ప్రాబ్లం ఎలా వచ్చింది, ప్రాబ్లం ఎందుకు వచ్చింది, పాస్ట్ ఎక్స్పీరియన్సా, నీకు స్కిల్ లేకపోవడమా. ది సొల్యూషన్ ఫోకస్ థెరపీ డోంట్ థింక్ అబౌట్ ఆల్ దిస్ పాస్ట్, present and future. They don't think about past. Now there is a problem, we have to address the problem. That's all. So this is solution focused therapy. It focuses more on present and future, not on past. Okay. Here, this is this helps to support their future, explore their preferred future. It tries to explore their preferred future. నీకేం కావాలి ఫ్యూచర్లో, to explore their preferred future and the procedures to achieve that. Here there are here the client emphasizes the future, about that and bring about internal resources and external supports and establishing a positive goal. So the solution here, you came to the counselor with a problem, then it's okay, whatever is the problem with which you are suffering, what is your future goal, what do you want exactly. So taking that future goal into consideration, this establish it, the counselor helps to establish positive goals. నా గోల్ అవతల వాడిని చంపాలండి అంటే అట్లాంటి గోల్స్ పెట్టుకోవడానికి కౌన్సిలర్ హెల్ప్ చేయడు. కౌన్సిలర్ హెల్ప్స్ టు హ్యావ్ పాజిటివ్ గోల్స్. అంటే నాకు వాళ్ళతో రైవలరీ ఉంది కాబట్టి ఐ వాంట్ టు కిల్ దట్ పర్సన్, దిస్ ఇస్ మై గోల్ అంటే కౌన్సిలర్ వోంట్ హెల్ప్. కౌన్సిలర్ హెల్ప్ ఫర్ పాజిటివ్ గోల్స్. సో లెట్ మీ ఎస్టాబ్లిష్ ఏ పాజిటివ్ గోల్ and bring about internal strength to reach that. So what are the strengths you are having? And the solution focused therapy focuses on the strengths of the person and future goal achieve cheyadaniki strengths ni identify cheyadam and resources ni identify cheyadam, both internal and external resources, and then it gives it makes the client to emphasize the future చూపిస్తాడు. ఫ్యూచర్లో సపోజ్ మామూలుగా అంటాం అనుకోండి, స్టూడెంట్స్తో అయితే మనం చెప్తుంటాం, స్టూడెంట్ కూడా ఇది వాట్ వీ డూ దట్. సపోజ్ ఇఫ్ యూ బికమ్ ఏ, ఆఫ్టర్ కంప్లీటింగ్ ద కోర్స్, ఇఫ్ యూ బికమ్ ఏ IAS ఆఫీసర్, క్లోజ్ యువర్ ఐస్ అండ్ థింక్ దట్ యు ఆర్ ఏ కలెక్టర్. వాట్ ఆర్ యూ డూయింగ్, హౌ డూ యూ థింక్, హౌ డూ యూ బిహేవ్, what is your status, how do you behave, how your parents will think about you, how your relatives will think about you, and what is the status you are having, what is the, we will explain everything, the house where you are living, what are the attenders, your decision making, you are meeting the prime minister, CMs, all this, and you are moving in flights, all these things, all positive things they will emphasize. To reach that you have to do this. That is a motivating factor. So the solution is there. So future solution, even for with children also we will do that. Future, emphasize their future. If they close their eyes and envisage themselves in that position, then they feel that like reaching that position. ఇది ఒక్క నిమిషం కాదు, ఒక పావు గంట చక్కగా డిస్క్రైబ్ చేయాలి నీట్గా, as though they are sitting in that position. Yes, then they want. Similarly, you have to also show them the future of a person who doesn't do anything. వాడిని కూడా ఎన్సైజ్ చేయించాలి, నీకు ఇది కావాలా అది కావాలో నీ ఇష్టం, యువర్ చాయిస్. సో దిస్ ఇస్ టు ఎక్స్ప్లోర్ దేర్ ప్రిఫర్డ్ ఫీచర్స్ and the client emphasizes the future of life, and where the problem is not there. Suppose if he comes without a problem, how do you behave? You are having a problem with this. If you don't have the problem, emphasize it too. Then this will be a motivation to the client, and he will follow the steps given by the client counselor. Okay, so this is solution focused therapy. This is very, at present times, this is very popular. Solution focus, this is a positive therapy, solution focused therapy, where they will gather all that strength and they will try to reach their goal, future goal, what they wanted, because this problem is becoming a hurdle for me to reach that goal. So think about that without that problem, envisage the future, and these are the things which you have to do to remove this from your day-to-day life. Like that, the counselor helps the facilitate the client to reach the solution. So this is all this. You will have brief therapies. We will go for brief and short-term therapies. Okay, and last one is integrative therapy. This is the thing which we always use. Behavioristic, psychoanalytical. మనం డాక్టర్ దగ్గరికి వెళ్తే మనకి అలోపతి డాక్టరు ఆయుర్వేదిక్ మల్టీవిటమిన్స్ ఇస్తారు, హెర్బల్ ట్రీట్మెంట్ ఇస్తారు, ఆయుర్వేదం, హెర్బల్, హోమియో అండ్ హోమియోటానిక్ ఇస్తారు, అలోపతి మెడిసిన్స్ ఇస్తారు. దిస్ ఇస్ ఇంటిగ్రేషన్. Similarly, we will use all the therapies, psychoanalytical therapy, like behavioristic therapy, cognitive therapy, together, integrate. There are inside therapies, so many therapies we studied. All this we will integrate and we will use depending upon the problem. So how to take the integration of all this? This is the thing which completes 3 volumes, and the 4th volume there is no need, I think. Again, the first unit is on teachings and learnings. So various skills of a counselor. In the first beginning itself, we studied characteristic of a counselor, counseling skills, how to do counseling, steps in counseling. All these are given in the first unit of the fourth book. Fourth book lo mottam first unit anta kuda repetition. Already we have studied all these things, and he has given and the second unit is about the current status of counseling in India. ఇండియాలో కరెంట్ స్టేటస్, ఎక్కడెక్కడ కౌన్సిలింగ్ సెంటర్స్, కౌన్సిలింగ్ కోర్సెస్ ఉన్నాయి, ఎక్కడెక్కడ ఇవన్నీ. ఐ థింక్ జస్ట్ యూ కెన్ గో త్రూ దట్ దెర్ ఇస్ నో కాన్సెప్చువల్ థింగ్ ఇన్ దట్. అండ్ ఇన్ ఇండియా మెయిన్లీ ఎన్సిఆర్టీ అండ్ NIMHANS, Bangalore. These are the 2 standardized institutes who are working on developing the counseling in a regular, in a in a concrete, organized manner in the country. So these are the things to, like that he has given ఇండియాలో ఎక్కడ ఏ యూనివర్సిటీలో ఉంది, అక్కడ ఉంది, ఇదంతా ఇచ్చేసారు ఇన్ఫర్మేషన్. సో దట్ ఐ థింక్ ఐ డు నాట్ డూ ఎనీథింగ్. This and third, e-counseling and ethics. Now the what is that? E-counseling. E-counseling means where we use email. Through emails, the counseling is very popular in US. E-counseling, which is being popular, and all the steps in that are given. Because my time is up, I have to give 5 minutes for interaction. This is, I'm not going in detail because there is no concepts in that. Second, last volume, he has given about e-concept, e-counseling and ethics in e-counseling, all this. Okay. So do you want anything? This is the last session on counseling. We completed 3 sessions, 21, 22 and this today is 23. Assessment, beginning, introduction. This is on interventions. Anything? Or shall we close?
Nothing, ma'am. Everything is crystal clear.
Wow. I have given only the outlines. There is a lot.
We need to study. Read the books, ma'am. Only then we might come out with doubts.
Okay. You have to read. There won't be doubt. No doubts will be there. But this is a description. What you have to do is, I feel, repetitions, you have to identify the repetition. Don't get confused by looking at everywhere. The wording is different. Everywhere the wording is different. Is it? So don't get confused about that. You go learn the concept. That's why I have not repeated again and again. Psychoanalytical theory is there in 3 places. Yeah. So that's why డోంట్ గెట్ కన్ఫ్యూజ్డ్, యూ అండర్స్టాండ్ ద కాన్సెప్ట్ ఆఫ్ ద థియరీ. ఒకే పాయింట్ 3 పుస్తకాల్లో ముగ్గురు రాస్తే 3 రకాలుగా రాస్తారు. పాయింట్ అదే. దట్ ఈస్ దేర్, దట్ ఈస్ హ్యాపెండ్, సేమ్ థింగ్. అందుకని డోంట్ గెట్ కన్ఫ్యూజ్డ్ అబౌట్ దట్. యు మేక్ యువర్ ఒకసారి తరవుగా చూస్తూ ఈ కాన్సెప్ట్ ఎక్కడైనా చదివామో మనం ముందు బుక్స్ లో, థీరీస్ మెయిన్ గా ఇఫ్ యు ఆర్ థరవ్ విత్ ద థీరీస్, ఒక్కొక్క దానికి కొంచెం కొంచెం అప్లికేషన్ మారిపోతుంటుంది. ఇంటర్వెన్షన్స్ కి టెక్నిక్స్ దగ్గర మారిపోతుంటుంది, అసెస్మెంట్ దగ్గర అంతే. మళ్ళీ అవే థీరీస్, ఆల్ థీరీస్ ఇఫ్ యూ షుడ్ బి థరవ్ అండ్ ద ప్రొసీజర్స్ ఆఫ్ కౌన్సిలింగ్. అది ఫస్ట్ బేస్. ఇఫ్ యు ఆర్ థరవ్, యూ హ్యావ్ టు లెర్న్ ద నేమ్స్, యూ హ్యావ్ టు లెర్న్ ద టెక్నికల్ నేమ్స్ ఎవ్రీవేర్. ఓకే, రైట్?
Okay, madam. We conclude.
Okay. Yes.
Thank you, ma'am. Thank you so much.
Okay.
Thank you, ma'am.
Yeah.
Thank you.
Okay. Welcome.